Ever found yourself in a constant battle with your own body, where every trip to the bathroom feels like a distress signal? Hello, I'm Deborah from Healthnews, and welcome to the world of ulcerative colitis. How does this internal turmoil begin, and is there a way to regain control? Stay with us as we explore ulcerative colitis and its management, offering hope and strategies for those touched by its unpredictability. Before we start, be sure to check the links for Healthnews' top probiotics. These are specifically curated for those managing ulcerative colitis. First up is VSL number 3 IBS probiotic capsules, 112.5B. These capsules are designed for daily use, packing a potent 112.5 billion CFUs per serving, ideal for those seeking a maintenance dose. They're known for their blend of 8 different strains of beneficial bacteria. These capsules are a go-to for supporting a balanced gut microbiome and are recommended for dietary management of IBS and ulcerative colitis. Next, the VSL number 3 IBS probiotic packets, 450B, offer a more intensive approach with 450 billion CFUs per packet. These are recommended by the manufacturer for those needing a higher potency probiotic for more severe ulcerative colitis symptoms. These packets contain a blend of lactic acid bacteria and bifidobacteria aimed at providing substantial support for the dietary management of ulcerative colitis and IBS flare-ups. Lastly, the VSL number 3 probiotic double strength packets, 900B, deliver a vast amount of 900 billion CFUs per packet. This double strength formula is intended for those with significant needs, such as individuals with ulcerative colitis or an ileal pouch. The comprehensive blend of strains is formulated to positively impact gut health, offering a robust option for managing symptoms and supporting overall digestive wellness. Now, what is ulcerative colitis, also known as UC? It's a chronic inflammatory bowel disease, or IBD, characterized by inflammation and the formation of ulcers on the lining of the colon and rectum. This condition is part of a group of diseases, including Crohn's disease and microscopic colitis, that cause inflammation of the gastrointestinal tract. Unlike Crohn's disease, which can affect any part of the GI tract, UC is restricted to the colon and the rectum. The exact cause of ulcerative colitis remains elusive, underscoring the complexity of the disease. However, the prevailing scientific consensus suggests that its development involves an interplay between genetic predisposition, environmental exposures, immune system dysregulation, and alterations in the gut microbiome. Let's review these cause factors in a little more detail. First, genetic predisposition. Research indicates a hereditary component to UC. Individuals having a first-degree relative with IBD are at higher risk at developing UC. This suggests that certain genetic markers may predispose individuals to developing UC. Second, environmental exposure. Lifestyle and environmental factors such as diet, pollution, and possibly stress have been implicated in UC. These factors may trigger the onset of the disease in genetically susceptible individuals. Third, a more general factor, problems with your immune system. In such instances, the immune system mistakenly attacks the lining of your large intestine, leading to inflammation. It's essential to note that UC is a complex condition with multiple factors associated with an increased risk of developing it. And how about the types of UC? Ulcerative colitis is classified by the Montreal classification system, depending on the extent, or anatomical location and severity of the symptoms. Different types of UC can present with varying symptoms and severity that change over time, influencing treatment and approaches and the management strategies. UC presents a spectrum of symptoms that can significantly impact the quality of life. Understanding these symptoms and the diagnostic process is essential for early detection and effective management of the disease. First, let's touch upon the symptoms of UC, which can vary widely among individuals. So this variance depends on the severity of the inflammation and the extent of the colon that is affected. Common symptoms include 1. Recurring diarrhea, 2. Abdominal pain and cramping, 3. Urgency to defecate, 4. Rectal bleeding, 5. Weight loss, 6. Fatigue, 7. Fever. Symptoms can fluctuate with periods of intense flare-ups followed by times of remission when symptoms may decrease or disappear entirely. The unpredictability of these cycles adds to the disease's burden. Therefore, diagnosing UC involves a comprehensive evaluation that combines clinical assessment with a variety of tests. They are aimed to confirm inflammation of the colon and exclude other conditions with similar symptoms, such as Crohn's disease or infectious colitis. So let's review these diagnostic methods. First, clinical evaluation. A thorough medical history and physical examination help to identify characteristic symptoms and family history of IBD. Second, blood tests. They're used to detect signs of inflammation and anemia. Elevated white blood cell counts can indicate inflammation, while low hemoglobin levels may suggest anemia due to chronic blood loss. Third, stool tests. They help to rule out infections and things that mimic UC symptoms. The presence of white blood cells in the stool is another indicator of inflammation. And fourth, endoscopic procedures. There are 2 types: colonoscopy and flexible sigmoidoscopy. It enables the gastroenterologist to assess the extent and severity of the inflammation and to perform biopsies for histological examination. And lastly, imaging studies. While not routinely used for diagnosis, imaging studies like X-rays or CT scans can help assess the severity of a flare-up or detect complications. The integration of these diagnostic tools, guided by the latest clinical guidelines, ensures an accurate diagnosis of UC. This comprehensive approach, combining clinical, inflammatory, endoscopic, and histological parameters, is fundamental to developing an effective treatment plan tailored to the individual's specific UC type, symptoms, and needs. UC can also lead to several severe complications if not properly managed. Treatment strategies aim to control symptoms and induce long-term remission, as there is currently no cure for UC. Understanding these complications and the multifaceted approach to treatment is crucial for those living with UC. So let's review complications first. They can be local complications within the digestive system and systemic complications that affect the entire body. Key complications include anemia. Chronic blood loss from the rectum can lead to iron deficiency anemia, characterized by fatigue and weakness. Osteoporosis. Chronic inflammation and the use of corticosteroids in treatment can affect bone density, increasing the risk of osteoporosis and fractures. Increased risk of colorectal cancer. Long-standing UC, especially when it affects significant portions of the colon, substantially increases the risk of developing colorectal cancer. Regular screening through colonoscopies is recommended to detect precancerous changes early. The management of UC is tailored to each individual, focusing on reducing inflammation, controlling symptoms, and maintaining remission. Treatment options can include medications. Among them, agents to address inflammation and flare-ups, as well as to target immune responses. Another treatment option is adjustments to diet and lifestyle. While no specific diet is recommended for everyone with UC, certain foods like raw green vegetables and dairy products high in lactose may trigger symptoms in some individuals or should be limited during a flare-up. A balanced, nutritious diet is crucial, and some may benefit from supplementing their diet with probiotics, vitamins, and minerals, especially during flare-ups. Besides that, regular monitoring for those with UC is key due to the increased risk of colorectal cancer and other complications. This allows for early detection and intervention, significantly impacting long-term outcomes. Lastly, there is also a treatment option of surgery for those who do not respond to medication. The most common procedure involves removing the colon and rectum and creating a pouch from the end of the small intestine to maintain as normal bowel function as possible. While there is currently no cure for ulcerative colitis, a comprehensive approach to treatment and management can help individuals achieve and maintain remission, reduce the risk of complications, and improve quality of life. Collaboration between patients and healthcare providers is key to tailoring a treatment plan that addresses the unique needs of each individual with UC. That's it for today. Check out the links below for the best probiotics tailored to support your digestive health. Don't forget to subscribe to the Healthnews channel for more insightful videos, and join us in uncovering the tools and information you need for a healthier tomorrow. Your path to understanding and managing ulcerative colitis starts here.